you feeling? Please do let me know in the chat, coders. Good. Only one good. Only one good I got. How about the others? Was this an aha moment? I know it was an aha moment for a few of you. Great, yes. Good. We have learned something here. We have to light fresh up on our FDRs as well. So yes, the purpose of the group study is to learn new things too. Okay, great. So let us move on to the next scenario. So okay, let me move on to okay. So we have done with the integumentary system. So it's time to move on to the next chapter, musculoskeletal. And let's start with the first scenario for musculoskeletal. Okay, so what CPT and ICD code ICD-10 CM codes are reported for this scenario? Your options are 28002, LT, M72.2. The ICDs are same. So option B, 28060 LT M72.2. Option C, 28062 LT M72.2. Option D, 28008 LT M72.2. Preoperative diagnosis, plantar fasciitis, left foot. Postoperative diagnosis, same as preoperative diagnosis. Procedure, plantar fasciotomy, left heel. For informed consent, the more common risk, benefits, and alternatives to the procedure were thoroughly discussed with the patient, and appropriate consent form was signed indicating patient understand the procedure and its possible complication. This 61-year-old male was brought to the operating room and placed on surgical table in supine position. Following anesthesia, the surgical site was prepped and draped in a normal sterile fashion. The attention was directed to the left heel, where utilizing a 61 blade, a stab incision was made, taking care to the identify and retract all vital structures. The incision was deepened to the medial band insertion of the fascia. The fascia was then incised and avulsed from the calcaneus. The surgical site was flushed with the saline. Next, 1 cc of depot-medrol was injected in operative site. The site was dressed with light compressive dressing. Excellent capillary refill to all of the digit was observed without excessive bleeding noted. Hemostasis none. Estimated blood loss minimal. Injectables agent used for local anesthesia was 5.0 cc macrine with 0.5% epinephrine. Pathology, no specimens spent. Dressing, applied bactresin ointment. Site was dressed with light compressive dressing. Condition, patient tolerated the procedure and anesthesia well. Vital signs were stable. Muscular status was intact to all the digits. Patient recovered in operating room. What CPT and ICD code 10 CM codes are reported? So coders, your 2.5 minutes starts right away. Okay, that is time, and let me look in the chat. I can see only few answers on the chat. Please, coders, please go ahead and place your answers in the chat. Only then I can understand, or I can know um, how should I explain the scenario. So please make this an interactive session, and please place your best answers in the chat. As I said, no problem at all if you get it wrong. So I will give you 30 seconds more. So coders, please to put your answers in. Okay, so let me highlight the keywords here. We have plantar fasciitis, post-operative diagnosis same, procedure, plantar fasciotomy, left heel, patient placed in supine procedure, anesthesia was given, deepened to the medial band, insertion of fascia, incision was made, fascia was then incised and avulsed from the calcaneus, patient recovered well in the operating room. So the correct answer, as most of you have said, is going to be option D, and this is what a patient suffering from a plantar fasciitis will experience or will look like. So, plantar fasciitis is a common cause for the heel pain, and it involves an inflammation of the thick band of tissue that run across the bottom of each foot and connect the heel bone to the toes. So you can see in the image as well what a plantar fasciitis looks like. There will be an inflammation of the plantar fascia. Okay, and for a procedure, there can be two type of procedure: a plantar fasciotomy and a plantar fasciectomy. So for a plantar fasciotomy, an incision is made into your fascia, and it is discharged from your heel bone. And for a plantar fasciectomy, an incision is made and any scarred or inflamed tissue will be removed. So you all know what's the difference between a otomy and an ectomy. Ectomy means excision, well, otomy means incising into, okay, cutting into. So we had a plantar fasciotomy in our scenario. Yes, in the procedure inventory, we have a plantar fasciotomy of left heel, while in diagnosis inventory, we have plantar fasciitis. So don't get confused between those two terms, fasciectomy and fasciotomy. Okay, so now let's look into the code option. Option A 28002 is wrong because option A is coding for incision and drainage below the fascia. So did we had an incision and drainage or an IND procedure performed here? No is the answer. We had a plantar fasciotomy, and that's different from IND. And option D, B is coding for 28060, and that is incorrect because, as I said, we had plantar fasciotomy and not fasciectomy performed. So option B is coding for a fasciectomy procedure. Also option C, both are coding for a fasciectomy. So both options, option B and option C, are incorrect. And now we are left with option D, 28008, which is coding for a fasciotomy, a foot or toe and or toe. So cross-checking with the procedure entry, yes, the keywords matches, And that is your answer. So select the code that best matches your inventory list, and always have a forensic look into these terms. They might look like similar terms, so always have your forensic glasses on. Okay, so the correct answer for this scenario is going to be option D. Okay, how are you feeling, coders? Please do let me know. Did the explanation help? Okay, good, great. So let me move on to the next scenario from musculoskeletal. What CPT and ICD code 10 cm codes are reported? Option A 20525. The ICDs are same, so I won't repeat them after this. T84.84XA, G89.18, option B 20680, option C 20694, option D 20670. A preoperative diagnosis, painful hardware left foot. Postoperative diagnosis, painful hardware left foot. Procedure performed, removal of hardware left foot. Anesthesia, sedation, and local drain none. Estimated blood loss minimal. Indication of for the procedure. Patient is status post metatarsal fracture treated with internal fixation. Patient has suffered pain due to hardware for past 6 months. The patient's pain has been unresponsive to conservative treatment. We discuss the above mentioned surgery along with potential risk and complication, and patient understood and wished to proceed. Description of procedure: the patient supine with the patient supine on the operating table after unsuccessful induction of anesthesia. The left foot was prepped and draped in usual sterile fashion. In the area of the screw heads, 0.5 mercury percentage mercury was injected both onto the lateral side of the foot and dorsal midfoot, administering about 0.5 ml in each area. A small 0.5 centimeter incision through the skin were made, and a blunt dissection was carried down deep to the screw heads. The screw were removed with the screwdrivers. The incision were irrigated and closed with simple 4-0 nylon sutures. A sterile compression dressing was applied. The patient was taken to the recovery room in a satisfactory condition. Material sent to the laboratory, none. Complication, none. The condition on discharge, satisfactory. Discharge diagnosis, painful hardware left foot. What CPT code and ICD 10 CM codes are reported for this scenario? And coders, your time starts now. Okay, Curtis. Great answers in the chat. You all are super forensic. So let me walk you through this one. Post-operative diagnosis, painful hardware left foot, and indication for the procedure. We have status post metatarsal fracture, internal fixation, pain due to hardware, anesthesia, dissection was carried down deep to the screw head, screws were removed, and final diagnosis is also painful hardware of the left foot. And the correct answer is going to be option B. Great answers. I am impressed. Okay, so you all we all have been like had some friends, or maybe we had fracture as well. So it's not a new thing. We all know what a fracture is, and as you all know, fracture needs repair, a treatment, right? Fracture reduction or sort of kind of thing. So one of the kind of fracture treatment is by using internal fixation devices. So these internal fixation refers to a methodology of reconnecting your bones, and this might involve special screws, plates, rods, wires, or even nails that your surgeon will place inside your bone to fix them in the correct place. Sorry. You can see in the image as well. These are internal fixation devices which are used to connect the fractured bone, help them heal. Okay, so just thought to bring up this image. Does this images help you all? Is it good? Yes. Okay. And now let's bring up our procedure inventory and diagnosis inventory. So in procedure inventory, I do have a removal of fixation of left foot. Diagnosis inventory, we have a painful hardware of left. And these are all our code options. So option A is coding for removal of foreign body. We are not coding for a removal of foreign body. Again, some might say implant is a foreign body. Yes, it's an implant is a foreign body, but we have a more specific code for an implant removal. So option A is incorrect. 20525 is a wrong one. And option C, 20694, is coding for removal under anesthesia for an external fixation device. So it was clear from the documentation that we are coding for removal of an internal fixation device and not an external fixation device. So option C is also incorrect. And between option B and option D coding for 20670. 20670 is for removal of implant superficial. Okay, so coders, let me know, how did you know this was not a superficial implant that was removed? Let me know the chat, coders. Everyone got option B as correct answer, so you must have figured it out. So let me know, how did you know that this was a deep implant and not a superficial implant? I'm curious to know. Excellent answers. Okay, good. I was looking at your answer, so great. Forensic look. So I would read the documentation forensically. Sorry. So looking into the documentation, the procedure inventory, we see that dissection was carried deep to the screw heads, right? That term is sufficient enough to know that It was a deep implant that was removed. If it was a superficial implant, the surgeon didn't have to dissect deep to remove the screw. It would have been a superficial incision and a removal of the implant. But here, the surgeon or the orthopedic surgeon or the physician had to dissect deep to remove those screw heads. And that is the reason why I can say it is not a superficial implant that has been removed. So we had 20680 removal of an implant deep in this procedure being performed. So that's why option B is the correct answer. So did the explanation help, coders? Yes, sometimes we have to read forensically to get to the correct answer. So select the code that best matches your inventory.
Thanks for tuning in, and until next time, happy coding!